Dissociative identity disorder, previously known as a multiple personality disorder, is an effect of severe trauma during early childhood, usually extreme, repetitive physical, sexual, or emotional abuse. What is a dissociative identity disorder? Most of us have experienced mild dissociation, which is like daydreaming or getting lost in the moment while working on a project. However, dissociative identity disorder is a severe form of dissociation, a mental process which produces a lack of connection in a person's thought, memories, feelings, actions.
Is dissociative identity disorder real? You may wonder if dissociative identity disorder is real. After all, understanding the development of multiple personalities is difficult, even for highly trained experts, but dissociative identity disorder does exist.
What are the symptoms of dissociative identity disorder? Dissociative identity disorder is characterized by the presence of two or more distinct or split identities or personality states that continually have power over the person's behavior. With dissociative identity disorder, there's also an inability to recall key personal information that is too far-reaching to be explained as mere forgetfulness. With dissociative identity disorder, there are also highly distinct memory variations which fluctuate with the person's split personality. The alters or different identities have their own age, sex, or race. Each has his or her own postures, gestures, and distinct way of talking. Sometimes, the alters are imaginary people. Sometimes, they are animals. As each personality reveals itself and controls the individual's behavior and thoughts, it's called switching. Switching can take seconds to minutes to days. When under hypnosis, the person's different alters or identities may be very responsive to the therapist's request.
Along with the dissociation and multiple or split personalities, people with dissociative disorders may experience any of the following symptoms: depression, mood swings, suicidal tendencies, sleep disorders, insomnia, night terrors, and sleepwalking, anxiety, panic attacks, and phobias, flashbacks, reactions to stimuli or triggers, alcohol and drug abuse, compulsions and rituals, psychotic-like symptoms including auditory and visual hallucinations, eating disorders. Other symptoms of dissociative identity disorders may include headache, amnesia, time loss, trances, and out-of-body experiences.
While the causes of dissociative identity disorder are still vague, research indicates that combination of environmental and biological factors works together to cause it.
How is dissociative identity disorder diagnosed? Making the diagnosis of dissociative identity disorder takes time. It's estimated that individuals with dissociative disorder have spent 7 years in the mental health system prior to accurate diagnosis. This is common because the list of symptoms that cause a person with a dissociative disorder to seek treatment is very similar to those of many other psychiatric diagnoses. In fact, many people who have dissociative disorder also have secondary diagnosis of depression, anxiety, or panic disorder.
What's the recommended treatment plan for dissociative identity disorder? While there's no cure for dissociative identity disorder, long-term treatment is very successful if the patient stays committed. Effective treatment includes talk therapy or psychotherapy, medication, hypnotherapy, and adjunctive therapy such as art or movement therapy. Because oftentimes, the symptoms of dissociative disorders occurs with other disorders. such as anxiety and depression. Dissociative disorder may be treated using the same drugs prescribed for those disorders. A person in treatment for a dissociative disorder might benefit from antidepressant or anti-anxiety medication.